Approaches to the following intervention method will involve a focus on establish, restore, adapt, modify, and prevention. In collaboration with the occupational therapist, a personalized routine will be established that will offer a safe and effective way to accomplish each task while gradually working to restore the client's previous level of endurance. The intervention will also provide adapted and modified compensatory techniques, which will integrate sterile precautions while performing various activities of daily living. In conjunction with education on sterile precautions, the occupational therapist will also provide energy conservation and breathing techniques, which will prevent hospital readmission and ensure successful wound healing and recovery. Andrea is a 39-year-old single female. She underwent a coronary artery bypass graft and aortic valve replacement 5 days ago. Prior to her procedure, she was living in her second-floor walk-up apartment in the suburbs with her pet dog and bird. Andrea works full-time as an assistant manager in a convenience store. She has been independent all her life tasks, although the few months prior to her surgery, she starts to tire easily. She does not go out much socially and has a very limited support system. Andrea loves animals, and her pets are like her family. She is being seen by OT, PT, and daily nursing care. Her length of stay is expected to be 8 to 10 days. Her active range of motion in both upper extremities is within functional limits, also with post-surgical precautions. She fatigues easily and only tolerates 20 minutes out of bed at a time. She has pain from the incision on her chest. Her skin is intact, except for the surgical site, which is healing well. She could roll in bed using the rails and could only move from sit to supine by first raising the head of the bed. Andrea has refused to dress in anything more than a hospital gown. She will wash her hands and face sitting up in bed, but then is too tired to continue and allows the staff to complete her bathing. She expressed to all the staff that her goals are to return home to her animals and to work. She is willing to participate in treatment, but just doesn't have the energy. Today begins the first treatment session after she was evaluated.
Hi, sweetie. How are you doing?
You good? How are you?
Good. I'm Jennifer, the occupational therapist. We met like 2 days ago.
I remember you.
Remember?
Yeah.
I'm happy to see you reading the handout I gave you.
Yeah, it's
Bunch of breathing techniques, sterile precautions.
Yes, it's a bit confusing though.
I know. That's why I'm here, because we're going to go through it again today.
Oh, okay.
And hopefully we're going to do some mobility. Are you okay with that? Just some
Absolutely.
movement?
Is that gonna get me out of here?
Yes.
Let's-
Back to your job, like you said you wanted to do.
That's it.
Okay? Because you should be out of here. It's 5 days to go with your surgery, but we'll get you moving soon.
I can't
okay?
wait to get out of here.
Okay. So, first and foremost, let's just check your heart rate.
Always monitor vital signs before, during, and after therapy. At rest, blood pressure should be less than 140/90 to be considered normal. If a patient's blood pressure is more than 180/90, notify a physician.
Oh, you have cold hands.
Sorry.
As they say, cold hands, warm heart.
Thank you. Okay. So we're good. We're at 72. I think they're okay. It's just do a little bit of movement. Nothing crazy.
Okay.
So,
Although using rails to roll out of bed may decrease the amount of energy needed to complete the task, the pushing and pulling needed to grasp the rails with her upper extremities are unsafe following her sternotomy. Also, Andrea's bed at home may not have a mechanical function. Therefore, providing Andrea with this teddy bear will reassure that she remembers her set of precautions moving forward.
this is not like a typical teddy bear. This is going to help you. Because you told me that you love animals, you have a dog and a bird.
Oh, thank
right?
you.
So,
Thank you
but
for
this
taking
teddy
that
bear
into
is
consideration.
actually going to help remind you of your sterile precautions.
How?
Because when we're moving today and trying to help you get out of bed, I want you to hold him against your chest the whole time.
Oh.
Okay? You want to do that?
Okay.
So here, hold Mr. Teddy. And what we're actually going to be doing is helping you learn how to roll off into the bed and then sit up.
Okay.
Okay? And we're going to sit back down. Nice and easy. You can take a rest when you want to. But beforehand, I just want to run through the sterile precautions that we talked about.
Oh yes.
Okay.
Because I find very confusing.
Generally, any movements that require asynchronous movement between the two sides of the chest, any excessive shoulder flexion, rotation, abduction, or lifting more than 5 to 10 pounds are discouraged for the first 4 to 6 weeks after surgery.
That don't lift more than 5 pounds. So about a gallon of milk.
Oh,
Okay,
okay.
for up to 6 weeks.
Mhm.
Do not lift your hands up above your head. This or behind your back.
Okay.
Okay? Keep them nice and close to your chest. We want to make sure that incision heals.
Okay.
Okay? So, let's get started. You ready? Good to go?
Yeah.
Okay, so what I want you to do is bend your knees up on the bed, and then you're going to roll them over to the side, and hopefully that's
When rolling side to side in bed, bend your hips and knees and roll to the side with the trunk following. When moving from supine to sitting, roll onto the side, drop legs off the bed, and then push up using elbow. The other hand holds onto the bed rail for support only. Patients may be assisted by supporting their upper back and moving the hips toward the edge of the bed. Do not pull on patients' arms when assisting them into upright position.
well. Remember, you want to use your leg muscles, the stronger muscles, to get up, okay?
All right.
So hold the teddy bear, and you're going to push up with your legs.
Let me just.
Yeah, just yourself.
I don't want to show my private.
Of course.
There it is.
Patients are discouraged from using their upper extremities and encouraged to use the stronger muscles of their lower extremities when going from sitting to standing position. Always be aware of any signs of exercise intolerance or cardiac distress, including complaints of dizziness, excessive fatigue, heart palpitations, chest pain, confusion, or anxiety or fear.
All right. Okay. So slowly, you're gonna push. You're gonna bend your knees and come back down into the bed, holding that teddy bear.
I really like this.
I'm glad. I knew you would like it. Now, the same way, we're gonna go back into the bed. Lay down. Okay. So you're gonna come lean on your elbow. And then bring your
Modify
hand up.
activity requirements per patient tolerance. Gradually grade activities, slowly progressing the patient. The activity can be graded down by using OT assistance, which can help support her upper back and hips while moving towards the edge of bed. There should be no pulling on her arms to assist the upright position. To grade up, simply client can slowly begin to apply more pressure on upper extremities as her sternal incision heals and eliminate use of pillow.
You're gonna check your heart rate after that, okay? Because that was a lot of movement.
I'm very tired.
Just went up a little bit, nothing crazy, okay? So next time, that was really good. We'll practice it again and see how if you get a little better. And I want you to remember this once you get home, okay? Just for up to 6 weeks. This is really important.
Okay.
Okay, and then maybe in 2 days.
The patient should be encouraged to engage in normal ADLs, but minimize excessive shoulder movements, such as shoulder retraction and shoulder abduction. They should avoid holding their arms above their head for sustained periods, such as washing their hair. They should avoid excessive chest expansion movements with upper body dressing. They should avoid upper body twisting for reaching an object. They should minimize shoulder extension rotation movements, such as when engaging in toilet hygiene. They should avoid bending over to don lower body clothing to minimize inadvertent breath holding when bending forward. Cross one leg over the other to access feet for lower body ADLs, or consider the use of an assistive device.
Like my style?
In order to go back to work, you need to wear normal clothes, not a hospital gown.
You have a point, but
Right?
I'm not there yet, right?
There. Maybe in a couple days, okay?
Okay, I'll think about it.
Okay,
All right.
perfect.
Thank you, Jen.
No problem. I'll see you later.
Take care.